As a heart surgeon with decades of experience, I've had the privilege of helping thousands of seniors walk through my office doors, often worried about symptoms like chest discomfort, breathlessness, or sudden fatigue. These are real concerns, and while many assume the culprits are poor diet, stress, or simply aging, there's another factor that often flies under the radar: medications. Many seniors take pills daily, sometimes for years, prescribed to manage one condition, but quietly harming their heart. These medications don't always show side effects right away, but over time, they can weaken your heart muscle, raise blood pressure, or trigger irregular rhythms, potentially shortening your life. Today, I'm going to share the 7 most dangerous pills that could be silently damaging your heart, but I'm also going to weave in something equally important: how nutrition and food choices can support your heart health as you age. This isn't about fear, it's about empowerment. If you're over 60, or you love someone who is, and you're managing conditions like pain, sleep issues, blood sugar, or mood with medications, you need to stick with me until the end. We'll also talk about practical, heart-healthy food swaps and habits to protect your cardiovascular system. And don't worry, I'm not telling you to stop any medication without your doctor's guidance. My goal is to arm you with knowledge so you can make informed choices and live a longer, healthier life. Let's start with pill number 7 and explore how food can complement your efforts to keep your heart strong. Nonsteroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen and naproxen, are incredibly common among seniors. These are the go-to pills for arthritis, joint pain, or backaches, issues that so many of us face as we age. I've seen patients pop these over-the-counter painkillers daily, thinking they're harmless, but they can be a real threat to your heart. NSAIDs can raise your blood pressure and cause fluid retention, which forces your heart to work harder than it should. For an aging heart, this extra strain can tip the scales toward heart failure or irregular rhythms. Over time, these drugs can damage blood vessels and impair kidney function, which further stresses your cardiovascular system. If you're already on heart medications or have high blood pressure, NSAIDs can interfere with your treatment, making it less effective. You might not notice the effects immediately, but your heart is under constant pressure. Now, let's talk about how food can help here. Chronic pain often stems from inflammation, and while NSAIDs might seem like a quick fix, a diet rich in anti-inflammatory foods can make a huge difference. Think about incorporating fatty fish like salmon or mackerel, which are packed with omega-3 fatty acids that reduce inflammation naturally. If fish isn't your thing, try walnuts or flax seeds. Pair these with colorful vegetables like spinach, kale, and bell peppers, which are loaded with antioxidants that fight inflammation. Turmeric, with its active compound curcumin, is another powerhouse. Add a pinch to your soups or smoothies. By shifting your diet to include these foods, you might reduce your reliance on NSAIDs over time, easing the burden on your heart. Of course, always talk to your doctor before using NSAIDs for more than a few days, and ask about safer pain relief options. Pain relief shouldn't come at the cost of your heart, and the right foods can be your ally in this fight. Moving on to pill number 6, we have certain diabetes medications called thiazolidinedians, like pioglitazone. These are often prescribed to manage type 2 diabetes, a condition that affects millions of seniors. While they're effective at lowering blood sugar, they can quietly harm your heart by causing fluid buildup, swelling in the legs, and even increasing the risk of congestive heart failure. This is especially concerning for seniors over 60, who are already at higher risk for heart disease. The fluid retention these drugs cause puts extra pressure on your heart, and the scary part is that symptoms like tiredness or shortness of breath can be mistaken for normal aging or diabetes itself. These medications can mask early signs of heart failure, making it harder to catch problems before they escalate. If you have a history of heart issues or notice swelling, it's critical to discuss safer alternatives with your doctor. Now, let's pivot to nutrition. because what you eat plays a massive role in managing diabetes and protecting your heart. A heart-healthy diet for diabetes doesn't mean giving up flavor. It means choosing foods that stabilize blood sugar while nourishing your cardiovascular system. Start with whole grains like quinoa, brown rice, or oats, which release sugar slowly and keep your blood glucose steady. Pair these with fiber-rich vegetables like broccoli, Brussels sprouts, and carrots, which help control blood sugar and reduce inflammation. Lean proteins, like skinless chicken, turkey, or legumes such as lentils and chickpeas, are fantastic for keeping you full without spiking your sugar levels. Healthy fats from avocados, olive oil, and nuts like almonds can improve insulin sensitivity and support heart health. Avoid processed foods and sugary drinks, which can cause blood sugar spikes and inflammation, putting more strain on your heart. Small changes, like swapping white bread for whole grain or snacking on berries instead of cookies, can make a big difference. Work with your doctor to explore diabetes medications that don't compromise your heart, and let your plate be a powerful tool in managing both your blood sugar and cardiovascular health. Next up, pill number 5 is something millions of seniors take every night to help with sleep: sedative hypnotics like zolpidem or older drugs like diazepam. Sleep struggles are common as we age, and these pills promise restful nights, but they come with serious risks for your heart. Sedatives slow down your nervous system, including your heart rate and blood pressure, which might sound beneficial but can actually reduce your body's ability to respond to stress or oxygen demands during sleep. Over time, these drugs can cause or worsen sleep apnea, a condition where you stop breathing briefly during the night, putting immense strain on your heart. This can lead to dangerous heart rhythm disturbances. These medications can also interact with heart drugs like beta blockers, making them less effective, and increase the risk of falls and confusion, which are already concerns for seniors. Poor sleep is a real issue, but long-term reliance on sedatives can harm both your brain and heart. Let's talk about how food and lifestyle can help you sleep better naturally. Your diet can play a surprising role in improving sleep quality. Foods rich in magnesium, like almonds, spinach, and pumpkin seeds, can help relax your muscles and calm your nervous system. Tryptophan, an amino acid found in turkey, bananas, and oats, promotes the production of melatonin, your body's sleep hormone. A small bedtime snack like a slice of whole grain toast with almond butter or a banana can stabilize your blood sugar overnight and prevent wake-ups. Avoid heavy, greasy meals or caffeine late in the day, as these can disrupt your sleep cycle. Herbal teas like chamomile or valerian root can also be soothing additions to your evening routine. Beyond food, establishing a consistent sleep schedule and creating a relaxing bedroom environment, think dim lights and no screens, can work wonders. Talk to your healthcare provider about safer ways to address sleep issues, and let nutrition be part of your strategy to rest well without risking your heart. Pill number 4 is tricyclic antidepressants, older medications like amitriptyline or nortriptyline, often prescribed for depression, anxiety, or chronic pain. These drugs were once a mainstay, but they carry significant heart risks, especially for seniors. They can cause irregular heartbeats, blood pressure changes, and even a dangerous condition called heart block, where the heart's electrical signals are disrupted. For seniors with existing arrhythmias or slow heart rates, these drugs are particularly risky. They also increase the chances of dizziness and falls, which can lead to injuries and further complications. Even small doses, taken over long periods without monitoring, can be harmful. Newer antidepressants are often safer for the heart and brain, so if you're on a tricyclic, it's worth asking your doctor about alternatives. Nutrition can also support your mental health and reduce the need for these medications. Omega-3 fatty acids, found in fatty fish, chia seeds, and walnuts, have been shown to improve mood and reduce symptoms of depression. B vitamins, especially B6, B12, and folate, found in leafy greens, eggs, and fortified cereals, are crucial for brain health and emotional balance. antioxidant-rich foods like berries, dark chocolate eggs in moderation, and colorful vegetables can reduce oxidative stress, which is linked to both depression and heart disease. Avoiding processed foods high in sugar and trans fats is key, as these can worsen inflammation and mood swings. A Mediterranean-style diet rich in whole foods, lean proteins, and healthy fats is a great model for seniors looking to support both their heart and mind. If you're experiencing fatigue, dizziness, or heart flutters while on tricyclics, don't ignore these signs. Talk to your doctor about safer options and let your diet be a foundation for better mental and cardiovascular health. Before we move to pill number 3, I want to highlight a tool that can empower you to take control of your health. If you're over 60 and taking medications or just want to protect your heart, consider downloading the Senior Health Tracker app. It's designed specifically for seniors to track medications, log symptoms, and catch early warning signs before they become serious. Unlike most apps, this one is tailored for your age group, making it easy to use and incredibly practical. Due to high demand, access is limited this week, so don't wait. You'll find the download link in the pinned comment or description below. It's a simple step to stay informed, stay safe, and keep your heart strong. Now, let's dive into pill number 3, a common medication for colds and allergies that could be putting your heart at risk. Decongestants like pseudoephedrine and phenylephrine are found in many over-the-counter cold and allergy medications. Seniors often reach for these to relieve nasal congestion or sinus pressure, especially during seasonal changes. But these drugs can be dangerous for your heart. They work by narrowing blood vessels in your nasal passages to reduce swelling, but this also narrows blood vessels throughout your body, including those supplying your heart. This raises your blood pressure and forces your heart to pump harder, which is especially risky if you already have hypertension or heart disease. You might feel jittery, anxious, or dizzy after taking them. Those are your heart's warning signs. Many assume these medications are safe because they're sold over the counter. But as we age, our bodies react differently, and what felt harmless in your 40s can now be a major heart risk. Nutrition can help here too. To prevent or manage colds and allergies, focus on immune-boosting foods. Vitamin C-rich foods like oranges, strawberries, and bell peppers can strengthen your immune system, reducing the frequency of colds. Zinc, found in pumpkin seeds, lentils, and lean meats, is another immune supporter. Staying hydrated with water or herbal teas can keep your nasal passages moist, reducing the need for decongestants. Warm soups with garlic and ginger can also soothe congestion naturally while providing anti-inflammatory benefits. Always read medication labels carefully and talk to your doctor before using decongestants, especially if you have heart concerns. By pairing a nutrient-rich diet with mindful medication use, you can breathe easier without stressing your heart. Pill number 2 is proton pump inhibitors, or PPIs, like omeprazole and pantoprazole, commonly used to treat acid reflux and heartburn. Millions of seniors take these daily, believing they're safe, but long-term use can increase your risk of heart problems. PPIs reduce stomach acid, which helps with reflux but can impair your body's ability to absorb key nutrients like magnesium. Low magnesium levels can lead to irregular heartbeats, fatigue, and muscle weakness. Over time, PPIs can also disrupt gut bacteria, contributing to inflammation linked to heart disease. These medications should be used for short-term relief unless absolutely necessary, so if you've been on them for more than a few weeks, it's time to reassess with your doctor. Nutrition is critical for managing acid reflux without relying on PPIs. Start by avoiding trigger foods like spicy dishes, citrus, caffeine, and fatty meals, which can worsen reflux. Instead, opt for smaller, more frequent meals to prevent stomach acid from building up. Foods like oatmeal, bananas, and melons are gentle on the stomach and can soothe irritation. Ginger, whether in tea or added to meals, is a natural remedy for digestion. Alkaline foods like leafy greens and broccoli can help neutralize stomach acid. Maintaining a healthy weight through a balanced diet is also key, as excess weight can put pressure on your stomach, worsening reflux. Work with your doctor to address the root cause of heartburn rather than masking it with long-term PPIs, and let your diet support both your digestion and your heart. Finally, we've reached pill number 1, the most dangerous and commonly used medication that's quietly weakening senior hearts: certain calcium channel blockers, like verapamil and diltiazem. These are often prescribed for high blood pressure, chest pain, or arrhythmias, but they can be risky for seniors. While they relax blood vessels, they can also slow your heart rate too much, leading to dizziness, fainting, or dangerously low heart rates. Over time, they may cause swelling in the legs, shortness of breath, and heart rhythm changes. They can also interact with other medications, increasing complication risks. The biggest issue is that many seniors take these without regular monitoring, and side effects are often mistaken for aging. Never stop a heart medication without your doctor's guidance, but always ask if there's a safer, newer option. Nutrition can play a huge role in managing blood pressure and supporting heart health naturally. Potassium-rich foods like bananas, sweet potatoes, and spinach help regulate blood pressure by balancing sodium levels. Magnesium, found in nuts, seeds, and whole grains, supports healthy blood vessels and heart rhythm. Limit sodium by cooking at home with fresh ingredients and using herbs and spices for flavor instead of salt. Heart-healthy fats from olive oil, avocados, and fatty fish can reduce inflammation and improve cholesterol levels. A Mediterranean diet, rich in fruits, vegetables, whole grains, and lean proteins, is one of the best ways to support your heart while potentially reducing your reliance on medications. To wrap things up, if you're over 60 and taking any of these medications, NSAIDs, thiazolidinedians, sedatives, tricyclics, decongestants, PPIs, or calcium channel blockers, I'm not saying to stop them on your own. Instead, have an open conversation with your doctor about their risks and whether safer alternatives exist. As a heart surgeon, I've seen too many seniors end up in the hospital not because of an illness, but because of medication side effects. The goal is prevention, and that starts with awareness. Pairing this knowledge with a healthy diet can transform your health. Focus on whole, nutrient-dense foods, fruits, vegetables, lean proteins, whole grains, and healthy fats. Avoid processed foods, excess sugar, and sodium, which can exacerbate heart issues. Small changes, like adding berries to your breakfast, swapping white rice for quinoa, or sipping herbal tea instead of coffee late in the day, can add up to big benefits. Tools like the Senior Health Tracker app can help you stay on top of your medications, log symptoms, and monitor your heart health daily. Your heart is too important to ignore, so take control by staying informed, eating well, and asking questions about your medications. If you found this helpful, please share it with someone you care about and subscribe Senior Envision for more advice tailored to seniors. Stay heart strong, and let's keep your health first.